You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what's new in cosmetic dentistry? If you are unhappy with your smile, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Campbell. She is the founder of Laser and Integrative Dental Medicine of Northern Nevada. We've invited her on the program today to discuss advances in cosmetic dentistry. Dr. Campbell, welcome to the program.
Thank you for having me.
Now, before we get into today's topic, tell us a little bit about your practice. What kind of patients do you see?
Well, in my practice, we do provide all aspects of general dentistry, not exclusively cosmetic dentistry. We promote health for patients. That's very important. Health is really the foundation that you can build from in order to create a good cosmetic case. We always start with the basics. When patients come in, they'll have their complete examination, their complete set of radiographs. We check to see the condition, the health of the gum tissue, because healthy gums are very important. A lot of people are reading now and things other than Reader's Digest that, gum disease can be predictors of, heart problems and things like that. So we want to make sure that the patient is healthy. Once we are past that point, we always talk a little bit about what it may be that people are dissatisfied with their teeth. Everyone perceives themselves a little differently. So it's very important for us to hear from the patient what it is that bothers them. And then we go from there.
Now you feel, obviously you're a dentist, but you feel the smile's pretty important.
Absolutely.
How so?
Well,
as you see it.
The smile is in the middle of your face. No matter how we try to hide that, first impressions are very important. When somebody comes up and meets you for the first time, what are they going to notice? Your smile.
Smile. You have a great smile.
Well, thank you.
Anything, do you have veneers?
No, I do not. I was very lucky. I had a very good orthodontist who helped me to set up the type of smile that I was looking for. This was very specific. I went in with specific things that I wanted changed in my smile, and what they did is they did a computer scan, which is new in orthodontics. They did a scan for me, and that way they could move the teeth into position, and that way I could see exactly what it was going to look like before it was completed.
All right, now let's talk about your background and education and we're going to get to these before and after photos because they're pretty dramatic. How did you become a dentist, by the way? You don't look like a dentist to me.
Well, I actually started as a dental assistant, and the doctor that I worked for saw how I worked with patients and the types of things that I could do for him, and I picked up on procedures very easily, and he's the one that encouraged me to go to dental school.
Now what's changed, by the way, in the last 10 years when it comes to cosmetic dentistry?
There's all different types of things. One of the main things in cosmetic dentistry is a lot of times we might do a little bit of recontouring of the gum tissue in order to give the illusion that maybe teeth are longer, teeth are wider. In the past, that involved scalpels, stitches. Not that way anymore. We use lasers for that.
Yeah, tell me about the lasers. What do you use them for?
Lasers are fantastic because oftentimes we can do procedures with only topical anesthetic, meaning I take a cotton swab, I put a little bit of liquid on it, paint it across the gum line, and that's all you need. We've had a lot of advances also in laboratory techniques and materials. The kind of materials that we have now are stronger, last longer. Also in that there's the strength that we have now, we can make these restorations, whether it be veneer or crowns, a lot thinner. A lot of times in the past you had those bulky looking, chalky white teeth.
Well, in fact, anticipating this interview, I was thinking about veneers, and I feel like I could spot them 10 yards away. They're big and bulky. Are you saying that, I mean, is that in the hands of the dentist? Is that the materials as you put it?
In my personal opinion, I think it is in the hands of the dentist, because you have to know how to design a case in order to provide the laboratory enough space to work to make the teeth look authentic.
Okay.
If you don't, that's when you end up with those thick, bulky veneers.
What are the frequently asked questions about veneers? What do they want to know?
People want to know, are they going to look real? What color are they going to be? And of course, the most important thing, how much they cost.
Right. Now, what about pain in the process?
What I tell patients is when they come in for cosmetic procedures, their downtime would be the same as if they came in and had a filling done. If we need to use local anesthetic, which we do in some cases, then their downtime is the length that the anesthesia lasts, which is usually 3 to 4 hours.
How much is art and how much is science when making a great smile?
I would say 50-50. The science part, that's mostly learned in dental school. I think that the art is something that, it's like style. You either have it or you don't.
Okay.
And you can have a great lab, but if you don't know how to design a case for each individual person, you're not going to get good outcome. When I design my cases, it's done on an individual basis. When you look at my before and after photographs, all of the teeth look different because they are designed for that person. The color is chosen for that person.
You say that you'll get a patient, change their smile, and they become a different person, or you change their lives.
Absolutely.
How so?
Well, for example, this patient here came to me, and he has been in pain for years. Besides not liking how his teeth look, obviously pain is a major component that drives people to come to the dental office.
How so, in this guy's case? What do you mean pain?
Well, in this particular person's case, he had some very bad gum disease.
Okay.
That needed to be addressed before we could do the cosmetic aspect. Address the gum disease, got that taken care of, got everything healed up. Then we went through the process of designing his smile. I had him bring in some old photographs of how he looked when he was younger. That also helps to give me an idea of the direction that I'm going. Your tooth form, length, color, that's all hereditary. And I need to know where we started in order to begin that process. So what I did for him is I took some photographs, I took some molds of his teeth, and then I designed on paper how I want it to look, and I sent it off to the lab, and I asked them to do a mock-up for me in wax so I can see what it looks like. That way when the patient comes back, I can say, this is how you look now, this is the direction that we're headed.
Okay.
And then once they approve that setup that I have, then we move forward. The thing that I like about that is that is the setup we start with. That doesn't mean that that is the end all and that's where we're going to be. It gives me a base to start. Once I go in and prepare the teeth, the temporaries match my mock-up. Once those temporaries are in, the patient can say, well, this tooth looks a little too wide.
So they get to try them in first?
Absolutely. And I make any adjustments that they need. I make them right there in the chair. Then I take an impression of those temporaries and I tell the lab this is what we're going to follow. And it comes back looking exactly like that.
On a guy like this, I mean, huge difference. What'd you do for him? How many veneers?
This is a full mouth rehabilitation, meaning that every single tooth is either a crown or a veneer.
You say you see changes in people's personalities after you take care of their teeth.
Absolutely. Most of the time what it is, especially for women, the women that I see are very self-conscious about how they look. They don't want to smile.
Is that right? Is that what they tell you?
Exactly. A lot of times what I have to do is coerce them into smiling in order to get a photograph to start with. Because if you ask them to smile, they'll give you, you know, show just a tiny little bit of teeth. I need to know what the overall smile line looks like so I know where I can go to design a good case for them. And I have a perfect example of that. This particular patient works in the beauty industry. People come to her for hair, for makeup,
It's a pretty good smile, though.
You're right. It is a pretty good smile. Where she started out was, if you notice, in between her teeth looks a little bit yellow in the front.
Yeah.
That's some old bonding. She used to have some spaces in between her teeth. There's also some crowns in the front. I don't know if you could tell which ones are crowns and which ones are her. Can't tell there. Also, if you look, her smile is it's a little dark towards the back. You don't really get to see a full, broad smile. That is because in her particular case, she still has some baby teeth that have been retained. So what we did for her is we did our mock-up in wax. I took some measurements of her teeth and from looking from old photographs, and we created this new smile for her.
It's great.
Now, the thing that I thought was most dramatic about her is I saw her about 6 months later. She came in for her follow-up visit, and I didn't recognize her. She lost about 35 pounds. Changed her hair, changed her makeup. She looked like a completely different person.
Is that what happens? Take care of their teeth, then they start taking care of themselves?
Absolutely. The confidence level goes up significantly, especially my patients that deal with the public, work with the public, whether it's in this patient's case, you know, in the area of, you know, beauty and cosmetics, or a lot of the businessmen that I see. They go to meetings, they travel around the country, they do international travel. They see themselves in before and after pictures. This particular patient, I actually just saw her a few weeks back again for another follow-up, and she was doing a 50th wedding anniversary for her parents. And she said she couldn't believe, in looking at all old family photos, the transformation of her teeth over time. You know, when she was younger, she had a lot of gaps between her teeth. Then she goes through the phases where she has bonding. Now the bonding's discolored. Now she goes through the phases where she has her veneers, and she said, you know, these are the best my teeth have ever looked.
Now when they see their teeth in a mirror, the new teeth, the veneers, for the first time, you get some tears?
It's always a shock.
Is that right?
Because they don't perceive themselves that way. It takes time for them to get used to, this is really how I look. I see a lot of tears. Tears of joy.
Tears of joy.
Tears of joy.
Okay, we're going to take a quick break. We come back. I want you to take me through the process, what somebody can expect on day one. You're watching the Wellness Hour, leader in medical news and information. We are here with cosmetic dentist Dr. Campbell, and we're discussing what you can do to change your smile. We'll be right back. You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We are here with cosmetic dentist Dr. Campbell, and according to Dr. Campbell, you could change your smile and change your life.
Absolutely.
In many cases. So what are some of the motivations? You say people do this special occasions, things like that, changes in their lives.
Special occasions, big changes. Sometimes it's divorce, which is an unhappy time for people overall. Weddings, birthdays, reunions, graduations.
I mean, it's a healthy look, you know, when I look at your before and afters.
Well, when you look at the public in general, you go out to the mall, you look at people, most young people, you know, their teens and 20s, their teeth are very white, they're straight most of the time, not a lot of chips in them. As we age, teeth tend to yellow or gray depending on habits. A lot of us like to drink red wine, green tea, some of us smoke. Also, wear patterns. Just like everything else, teeth wear over time. So a lot of times if you look at somebody in their 40s or 50s, depending on how well they've taken care of their teeth, can really age them a lot if they are dark in color or have a lot of chips or broken teeth.
What are the age ranges? Because, I mean, 60 is young today.
Absolutely.
I mean what is the...
typically my patient population are mostly in their 50s and 60s.
And they're coming in for veneers.
Absolutely.
And
I have 80-year-old grandmothers coming in for veneers.
Now, why would somebody 80 years old want to do
well,
that?
this particular patient told me she knew she was going to live to be over 100, so she definitely had at least 20 good years left.
Okay.
And she wanted me to make her look younger.
Take me through the process. Somebody goes in on day one. What goes in, and how much say-so do they have in what their teeth are going to look like?
Okay. During day one, they'll come in and they'll have their examination. We do the basics.
Are they nervous, by the way?
A lot of times they're nervous, and you can usually tell because they're crossed over in the chair. But I have a wonderful, wonderful staff, and they are so good about making patients feel comfortable and going through that. So when they come in, they meet the staff first. They meet the front office and the back office. They have their full set of radiographs done, and then I'll come in and we'll sit down and talk for a while because I want to know what brought them to me, what
so you meet them one-on-one?
Absolutely. Okay. We spend a lot of time talking during our first visit because I want to know what their concerns are.
Well, and what do they say? I mean, are there certain people that absolutely their teeth hold them back? I mean, psychologically, they think everybody's looking at their teeth.
Some people, I can't even get them to smile to take a photograph. We have to tell jokes and coerce them, and I'm sitting back with the camera waiting to catch that moment when I can get their smile so I can see what we're dealing with, because sometimes it's very traumatic for people, especially if they've had a bad experience in the past. They want help, but the fear holds them back.
Do you show them catalogs about what teeth should look like?
No, I do not. What I do, I explain to the patients that the way I design a case is unique and special for each individual.
Okay.
And I do that through taking a series of photographs, molds of the teeth, and then I sit down and just think to myself, you know, what do I think would just really make them have an incredible smile? It's very artistic. It's hard for me to put into words what it means. I just know in my mind what looks good and what doesn't.
Do they ever come in with photographs of a celebrity? Let's say Julia Roberts. She has a great smile. And they say, I want that. Does that come in?
People do bring that, and what I tell them is I will design what I think is appropriate for them.
Okay.
They at any point can change that, but to put somebody else's smile into your face, it's not going to look the same. And they're not going to be happy. And it's hard for me sometimes to translate that into words, and that's why I send instructions to the lab and have them do a mock-up and wax. It's much easier for people to hold in their hand a model. This is what my teeth look like now, and this is what they're going to look like when they're done. For them to really be able to see it. Photographs, what people don't realize is when you look in fashion magazines and things like that, photographs are touched up.
Okay.
They're doctored. That's not real life.
Is Hollywood, I mean, as a dentist, when you see smiles, can you tell, you know, they definitely had something done? Because veneers have become mainstream.
The cases that I consider okay, yes, I can. The ones that impress me are the ones that I can't tell that they're veneers. But I may read about it somewhere. I would go to a seminar and, you know, that person would be presenting that case. That to me is impressive.
Now, why has it become so mainstream, it seems? You know, shows like Extreme Makeover, things like that.
We are definitely in the age of reality shows. You can't turn on the TV these days without seeing something like that. And I think for people, our culture wants instant gratification. So in an hour, they can see a tremendous transformation. What I do explain to my patients is that what they see on TV didn't occur in an hour.
Right.
There's a process that you go through in order to achieve that. But it does give people an idea of what's possible out there.
But with a healthy mouth, okay, the ideal situation, they come to you, their teeth have shifted, they didn't wear their retainers. From beginning to end, how soon can they have their veneers, their great smile?
With my process, it usually takes about 6 weeks, and that is because I always do a mock-up and wax first. I never
so they know what they're...
Exactly. I'm one of those people, I like predictable. I don't like big surprises at the end, especially when it comes to putting in teeth. So it's very important to me to do all the preparatory work. I tell them that's really where the design comes in, is in the beginning. You want to have a good design. You wouldn't go out and build a house without a blueprint.
Okay.
It's the same thing. This is my blueprint to create a beautiful smile for them.
In your eyes, what makes up a great smile?
Color, first of all. The color should blend with your skin tone. It shouldn't be something where your teeth are so white they can see you from across the room. A lot of people have seen the episode of Friends where Ross went and got his teeth bleached and he was glowing from across the street. That's not what you want. You want your smile to enhance your personality, not completely define your face. So when I look at a smile line, your upper teeth should graze your lower lip as you smile. Teeth are not straight across. They graduate, get a little bit higher as you go back. And so all those factors have to be taken into consideration when you're designing a smile for somebody.
Now, do you see yourself as an artist?
I think that dentistry as a whole, especially when you're talking about cosmetics, is very much an art. When I look at people, people's teeth are not the same. And they shouldn't all look the same.
Is there cookie cutter type of work going on nationwide?
Absolutely out there. I see that a lot. I see that a lot where I live and in other places that I practice.
Can you spot a bad veneer case?
In my eyes, if I can tell it's a veneer case from just conversational distance, then in my mind, yes. Now,
I interrupted you earlier when I asked you, you know, what makes up a great smile. You mentioned color. What else?
How many teeth you show when you smile. When you take a photograph of yourself with straight on, you see 6 teeth. And that's typically what people are used to saying. They'll come in and they'll say, I want my front 6 done. What they don't realize is when you look at a family photograph, and let's say you're not in the front of that photograph, you're off to the side, so now you get a profile shot. Now instead of seeing 6 teeth, you might see 1 or 2, and it almost looks like there's a dark space towards the back. When you look at people like Julia Roberts, for example, who has such a broad smile, you can see a lot farther back. And I think that that's really, really important in creating a smile line for someone. Why don't I give you an example of how teeth are not perfectly straight across.
All right.
This particular patient, which is an older lady, she came in, she has some crowns in the front, some are natural teeth, it's hard to tell which are which. Notice the color here, Randy. A little bit darker, some of these are older crowns, some of them are veneers. You cannot change the color of an older restoration without replacing it. These types of things don't respond to bleaching. So when we're looking to make a more youthful smile, that involves changing the color. In her after photograph, you can see how much whiter her teeth are.
Very nice.
You also can look, you'll notice that the front teeth are a little bit longer than the teeth on either side.
Why do you do that?
Because that is, in youth, if you look at how your teeth were when they first came in your mouth, that's what they look like. Teeth are all different shapes and sizes. You look at the eye teeth, they're slightly pointed. They're a little rounded on the end, but they're a different shape.
And that's an older patient, because that's a very young, you know, sexy look.
Absolutely, and she looks fabulous. She was beautiful before, now she's just more beautiful now. This is another one, just an older smile. This particular patient, she has some older crowns, some older fillings that look a little yellow. Those don't respond to bleaching.
Is that a big part of your practice, people that had, you know, older type of dentistry and now they're
Absolutely, because what people don't realize is just like cars or any kitchen appliance, dentistry doesn't last forever. It does have to be replaced periodically. You've had crowns 10 to 15 years, it's time for an upgrade. When you look at her after smile, you can see that we designed a case, the tooth size fits
completely natural,
her
by
face.
the way.
It looks
and those are
completely-
veneers?
All the way back.
All right.
All the way back. But what you can also see in her after photo is we have only created her smile for her top teeth because that is what she requested. If you look closely, you'll see some of the older crowns on the bottom. You can pick those out right away just by the color difference.
Do they end up coming back and saying, I've got to do these bottoms?
Absolutely. I had one patient, I did the top for him, and he said, when can I do the bottom?
Is that right?
I had a feeling he'd want to do that, so I already did all the preparatory work, so I already had all of my models and things done. So in his particular case, we did the bottom the next day.
Mostly women doing this?
Actually, most of my makeovers are done on men. A lot of our older patients, and I don't want anyone to feel, you know, slighted when I say older, meaning, you know, 40s and 50s, but our workforce is staying in a lot longer. So if I have gentlemen in their 50s and 60s coming in saying, I'm going for a new job interview next week. You know, I'm competing against 20 and 30-year-olds. I want to look the best that I can look. What can you do for me? And then we go through and designing their case for them.
Now, you use a term called instant orthodontics. What is that?
Instant orthodontics, sometimes people will come in, their teeth will be slightly crooked in different spots, and they choose not to go through orthodontics in order to do the straightening process. I have a great example of that here. This particular patient was not happy with her two front teeth, how they overlap. She wanted to create a more even smile for herself. One option would be to have orthodontics done. She decided that she didn't want to wait that long.
Now, how old is that patient about?
This patient is in her early 60s.
Okay.
Okay, so we
Now,
went
is this
through.
something she wanted to do for many, many years and put it off because she just doesn't like going to the dentist? What is it?
This particular patient, we all get caught up in the busyness of everyday life, raising a family, working, having jobs. You know, once we get into retirement, the kids are gone and out of the house, then a lot of my patients say, you know what, it's time for me.
Okay.
They have the resources to do it, they have the time to do it, and they want to spend some time on themselves.
So when you see that, and you call it instant orthodontics, so she comes in, and how many veneers does she get?
Randy, let's take a look at this after. This person has a combination of 11 veneers or crowns, depending on which was applicable for the tooth. And if you look at it, you can see what a more youthful smile she has. We changed the color, we changed the alignment. When you look at it, you can see that the two front teeth are slightly longer than the teeth on either side, which is very
Kind of
important.
like her teeth before.
Exactly.
Just brand new, I guess.
Exactly. So when she brought in her photographs of how things were when she was younger, that helped me decide on how to design this case for her.
So now what happens? She flashes her smile to her friends. I mean, when she comes back, what does she say? I mean, do people treat these people differently?
What I find that I think is the most amazing is when patients come back with stories, it's not that people notice their teeth, it's they notice that there's something different about them. Usually they're asked, did you lose weight? Did you get a facelift? That's my one that I always think is the funniest.
Now with veneers, they don't stain, you say? Because I guess it's glass.
Stain.
I mean, they're made of glass. Is that right?
That is correct.
Okay.
They do not stain. The only part that would be able to stain would be where the tooth and the veneer comes together, where that demarcation is. So it's very important to design the shape of the veneer so that doesn't show, should that become an issue.
Do they fall off?
They can fall off. It is a rare occurrence. With today's different types of materials that we have, especially bonding agents, they actually become part of the tooth. So oftentimes if something